Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements designed to support people with chronic kidney disease. And I'm joined again today by the fabulous, the wonderful, the ever so lovely Dr. Grace Liu. Dr. Grace is a pharmacist. She is also a A4M and an integrated regenerative practitioner. She's the founder of the Gut Institute. I'll make sure I put all those links in below. She's a clinical pharmacist with a doctorate in practice for 20 plus years. She specializes in optimizing lifespan, life force, and increasing endurance and energy for her executive clients and elite athletes. And I know you do some stuff with the NFL and other cool things as well. She formulates and makes products that rebuild the microbiome after damage from our busy modern lives. And she uses nutridromic tools and advanced testing. She is a queen of peptides and bioregulators, and she is also the queen of all things gut. Welcome back to the podcast, Grace. How are you?
Wow. January is just February, we're already February.
I know, it's true.
Hopping. Yeah. Yeah. I'm so excited. There's always so many new things on our horizon every day, every week, and it's just so fun to be a part of the flow.
Yeah, and I wanted to say to you, because Grace sent me her the Bifido Maximus. Is that what it was called?
Yes.
I love it, and I've put in a couple of patients because I obviously do microbiome testing where and you're interesting. You said last time in our last podcast, if anyone hasn't listened to it, go back and listen to it. But Grace was talking about just the lack of bifidobacter, especially after the COVID vaccine. And I had a few patients come through where I was looking at them, and normally in Australia we might still see a little bit, but I had literally, after we got off that call, 3 patients, 0 bifido. So I put them on because you sent me so many of those amazing. So I'm like, do I teach with this? I will share. So I gave them some Bifido Maximus and then put them on the 2FL.
Yes.
Retest, and we've already started retesting one of them, and their bifidos come right up into normal range. That was quick. That's like 6 weeks have been on it. So really cool.
Yes. Yes. I'm so grateful. Yes. The 2'-FL is awesome. Yeah. So is GOS, XOS, FOS inulin to feed them, and PHGG, partial
Yeah.
hydrolyzed argon. Just perfect to feed them. Yes. Oh, I'm so
So
happy for you and your clients. I know it's
yeah.
tremendous. Yeah.
No, it's amazing product.
Yeah. And when we're missing them, that's when we run into immune issues, like the topic today, autoimmunity. Like nowadays, maybe because of COVID and just all our environmental toxins and glyphosate, pesticide, herbicides on all our, or even organic foods, like
Hmm.
people show up for us, like not just one autoimmune disease, Fiona, you're probably seeing it as well, but like 3 all at once.
Yeah.
Like they didn't know they were pre-lupus with a high ANA, and then they've got Hashimoto's and like OA or Hashimoto's and some other autoimmune disease, Sjogren's or OA or um, RA or rheumatoid arthritis or just something else. I think
Yeah.
chronic fatigue is autoimmune. That's what I had and Hashimoto's.
Interesting. Yeah, I don't disagree. And I think endometriosis and fibromyalgia are autoimmune as well.
Absolutely.
Mhm.
Absolutely. Yeah. Yeah. We're just in
So
a sea of autoimmune disease.
we are, and it's funny, like a lot of my kidney patients with kidney autoimmunity also have Hashimoto's. That's a thing that I'm seeing as well, which is, big. But yeah, we wanted to talk about
Big.
autoimmune
Yes.
disease
Yes.
and just the gut microbiome and then all the things that you do to treat it. We don't just have to stick to the gut microbiome. I know you've got such a wide scope with everything that you do. I know you're really passionate about mold testing and obviously the peptides and the bioregulators. So when we're talking about autoimmune diseases and kidney disease, I guess just for clarity, the big ones we're talking about, and if I miss any, we're talking about lupus, IgA
Mhm.
nephropathy, the ANCA associated vasculitis. One that I'm seeing, and I was saying to you before I hit record,
Yeah.
that I've actually suddenly seen a huge influx in my clinic is good pastures or anti-glomerular basement membrane disease.
Mhm.
Trojans, and then RA, they're the sort of big ones. Are there any ones that I missed that you would see in practice that have got kidney
Can
associations?
develop and become autoimmune, but some of the drug-induced ones, like
Mm,
the the tubule diseases caused by drugs like sulfonamides and other sulfur group drugs, even NSAIDs.
yeah, right.
We're on
Okay.
a forum and like someone was saying, oh, about NSAIDs and kidney failure. I'm like, yeah, it's actually really common because the NSAID is pushed out by the kidney, and then it ends up being an immune complex at hapten. So it binds to one of our cells in the tubule on its way out, and then the body launches attack and eosinophilia there.
Yeah, right. Okay. Oh, and we should say Hashimoto's too, because so many of my kidney guys have Hashimoto's.
Yeah, and then their kidney creatinine starts creeping up. Yes, yes, yes. So from the microbiome point of view, when we lack any of the keystones, so I'll reiterate, like unless people heard the last podcast, people with longevity and really healthy human cohorts, they have a group, a core microbiome. They all have it, and I call it the ABCs. It's so simple. A for Akkermansia. And there should be, if we do testing and we see taxonomy, that means we're like drilling it down, kind of like a checkbook banking. We can drill them down and see the amounts there, but a healthy amount is 2 to 5%. And you can have too much, which is not good. And,
Mm.
none detectable at all, like we were talking about. And then the B, A is Akkermansia, B is for bifidos, all bifidos, but it's really important what the bifidos are. When we lose longum, bifidobacterial longum, if it's no longer dominant, then it's a mucus eater like Akkermansia, which is Akkermansia mucin. Longum is also a mucin eater, a mucus eater. When it loses its dominance, the sugar eaters come up, right? That's
Mm.
why a lot of people crave sugar. It's not just the yeast and candida and mold, but it's the bifido animalis, bifidobacteria adolescentis. Some of these are in probiotics, and I'm not a fan of them at all. Most of the time,
Mm.
if I'm checking the gut testing, they have high amounts of that. If there's bifidos present, which 50-50, most of the time they're not. But if they are, it's kind of the sugar eaters. And we want to replace those or just bring their dominance down and have longum, bifidolongum. The other B is, well, like that's the main B. And then C is Christian Sinella. We don't often talk about it as a gut flora, but
No,
it's
you don't.
present in non-diabetics. Because diabetes also is a big, chronic disease. It's not, I think diabetes is autoimmune too, if we added that in there.
Yeah,
And
it
even
is.
even fatty liver, NASH, I think that's
Yeah.
autoimmune too. But so yeah, so when we lose Christian Sinella, a C, it's associated with leanness, and when we don't have it present, a lot of things start breaking down, and including target organ disease. And then the other C is butyrate makers, the Clostridioides group, and it should be half of our whole gut microbiome. So when
Yeah,
we
right.
lose, yeah, if we lose this core, then we're at risk for all kinds of immune problems, and that includes autoimmunity. There's permeability that will happen as soon as we start losing these. Like when I see an extinct bankrupt bifidolongum, I know they have permeability. You don't have
Mm.
to do any other testing to try to assess that. Like you don't have to do zonulin or EPX or other testing. That to me is like enough. And CKD is kind of equivalent to permeability. So prior to that happening, before autoimmunity, or so when there's stress or losing these flora after antibiotics or having pesticides, herbicides, or other reasons, our gut becomes permeable, and then whatever we're eating starts to leak into our bloodstream. Sometimes it looks like kidney cells, and that's when the autoimmune process starts to happen. Or as our
Mm.
body tries to eliminate XYZ, protein and whatever our body's excreting, if it's going through the kidney, concentrating there, tubules and nephrons and Henle, that's when it starts to like get problematic because it'll get stuck, and then the body tries to eliminate it, and then a whole huge immune mess starts to happen, and the body starts rejecting our own kidney organs, and it can only do it for so long, and then it'll get fibrosed if the process continues, and then we see many disease processes happening. Yeah. So how do we bring, yeah, the health back?
Yeah.
Yeah. So it kind of depends on how inflamed someone is, where I go. And looking at root issues is always really important. How did the body lose that tight fortress in the gut in the first place? Right.
Hmm.
Yeah. Was it heavy metals? Was it, how much amalgam does someone have, or lead paint in the wall? And if they grew up, in a older home from the 70s or 80s here in the United States, it's usually homes built in the 70s and painted in the
Hmm.
70s earlier. Could be anything, right?
Yeah.
Yeah. So the first looking at root issues, mold is huge too.
I
Every
was
other,
waiting for you to say that one. Yeah,
yeah.
mold. It's a
Yeah. Do you
big,
see a
I
lot of
would
that?
say,
Yeah. Yeah. Do you see a lot of
huge
that
in
happening?
Australia. Yeah,
Yeah.
because of the humidity. And,
Mhm.
like I would say in 70% of my autoimmune cases, there's mold.
I would say like 100% in mine. Yeah,
Yeah,
it's
right.
so common, so common. Like with autistic kids and spectrum humans, adults and kids, like when they have so many mutation pathways blocked or homozygous for mutations, they don't excrete. So, when I'm checking for mold, it'll look like they're clean unless I do the provocation. And in the beginning, I don't always provocate because it creates too much havoc, extra havoc.
Mm.
Mold comes out or other toxins comes, streaming out too quick. So I don't
Hmm.
often, sometimes I'll not test it, but then I'll be like, oh, I should have provocated because if it comes up too clean, it's like, oh, well, Grace, it looks great. I'm like, no, like.
So for people that don't understand, just describe what provocate means, because people might be scratching their heads.
Yeah,
What
so
is
I
she doing
kind
to
of yeah,
people?
I follow kind of the standard Schumacher provocation and other mold gurus out there, like 1 gram of glutathione. Yeah, so Body Bio is a brand I love, or any brand, any
Mhm.
liposomal brand is awesome. If you want to
Yeah.
inject it or jab it, yeah, you can do that, but it's also kind of pain in the butt. But yeah, yeah, 4 a day, 1 gram a day, and liver support, but no binders, no charcoal, no clay. You can still take probiotics and any other things and supplements. Good liver support is really ideal. And then doing sauna. Um,
Mm.
Sauna cannot replace all our pills, potions, powders, peptides, all that. It really will like start to push the junk out. And especially for those who don't sweat, we have to starting that process is really important to heal and like fully, start. We're not going to fully remove all toxins at this point, but just start to move the dial on all of it. Yeah. So I do that, have them do all of that daily for 5 to 7 days, or if they're really fragile, just 2 or 3 days
Yeah.
and no binder. And then we collect the mycotox panel
Yeah.
and
And
then
you
we
will
truly
like to see,
see.
yeah, so I was going to say you'll see a clean panel suddenly test with microtoxins with doing.
Oh, oh yeah, yeah. And they might feel crappy during that time. Yeah.
Of
So
course. Yeah, yeah, yeah.
yeah, yeah, yeah. And we're not chelating, so this is only the mycotox picture. If you're like doing a provocation to look at heavy metals, then you have to do products that are going to really pull the metals out. Yeah, so that gets a little trickier. Like I like IMD from Quicksilver, it's really safe, but then you can go harder, like alpha lipoic acid or DMSA, and go
Yeah.
deeper. Yeah.
Yeah.
So kind of want to know what the root issue might be. Like talking with them is helpful. Maybe they had like a college dorm that was moldy and then they've been ill ever since, right? Or they went to India or traveled somewhere, Spain, and maybe there was a moldy hotel. Plus they got picked up 3 parasites somewhere, right? It's like, okay, something associated with that, and that
Yeah.
kind of gives a better picture. Like, oh, when did you start not feeling your perfect self, right? Yeah. And that helps to unravel like what we're gonna do exactly. Yeah.
Yeah.
Yeah,
So
because
yeah, walk me
autoimmunity,
through. So
yeah,
keep going.
autoimmunity will just come back again. And if it's not
100%.
autoimmunity, it'll be 3 cancers. No fun, right? And or something else. You're gonna, you're so inflamed, you're gonna, be more vulnerable to other stuff like more injuries, or you'll need like a total hip replacement or knee replacement or brain replacement, like I did. Yeah.
So walk me through. So patient comes in to see you and you're like, yep, autoimmune disease. You do your provocation and you've done your panel testing. Do you go straight for the gut? Do you do dietary stuff first, or are you doing it all quite holistically? Walk me through how you
Okay.
would tackle a patient.
Yes. The first thing we do, if they're not already, I don't even bother doing like a food allergen panel anymore, to be honest. Just because I say whatever you're currently eating, you're allergic to. Because when you're leaky, it's all going into your bloodstream
This
everywhere.
is a true
And
story, yeah.
yeah, once it's in your bloodstream, it's going everywhere, your brain, your butt, like everywhere. So they have to kind of switch things out. And the most stickiest proteins is the gluten and dairy, casein and dairy are
Yeah,
the worst. Yeah.
totally agree.
Egg whites is third. So people don't like it. It's their primary source of protein. It's like, ugh, gross. But yeah, we got to switch out eggs or just for a month. Just 4 to 8 weeks, we negotiate a little bit, but if they love eggs, but cut that out for a month. So those are the three ones. I used to cut out soy and corn and this and that, but those are the main hardest ones. I'm kind of hardline about that. I love peptides. Lorazepatide is my favorite.
You're
every couple of
injecting
days.
it, aren't you? I can't get, I haven't tried that one yet, but for
Oh,
people who
yes.
don't
In
know,
Australia, you guys have the best one from Level Up. I love it. Lorazepam and Limitless offers it as well, the pill.
yeah.
Certain places also have the injectable. I haven't personally tried that yet, but I ran out of Level Up, and so I was like shooting the 10 units into my mouth, like 500 micrograms when I ran out. And that was not too pleasant, not very pleasant. I prefer pills. So
Yeah.
I put, if, I mean, usually, I mean, if they're not that bad off, we'll just do 3 a day. But most people are kind of problematic, so we tighten the gut and do 6 a day. It's a little expensive, but it's only for the first month or two. Six a
Yeah.
day, yeah. So lorazepam, two at every meal. If they're a
Mhm.
child, we just sprinkle on the food. If they're highly, highly allergic, like mast cell, SIRS, mast cell stands for mast cell activation syndrome, SIRS, chronic inflammatory reaction syndrome, we'll sprinkle it on their food a couple times a week and get them used to it. It is foreign, and I do worry about people developing new allergies.
Mhm.
Yeah. So once we tighten the gut up, the body will start making less autoimmune antibodies attacking whatever the target organ is. We're talking about kidney disease. So now the body will have less attack for the kidneys. And sometimes in just 2 days of starting the protocol and our probiotic, people can start eating actually foods they've left off their plate for the last year or two or three. That's how quick it
Amazing.
works. Yeah, and going gluten-free. Some most are gluten-free, dairy-free by the time they get to our door. So
Ditto.
I'm
Yeah.
always, yeah, I'm always like surprised. Like, and they've already, like, every month they find that they're cutting out more and more foods. And as soon as you start cutting out FODMAPs actually are good for us. These are our primary prebiotics that feed the bifidos that keep our immune system and our gut tight.
Hmm.
So without bifidos that eat FODMAPs and oligosaccharides, GOS, FOS, XOS, which come in gooey cooked starches like tubers, taro, konjac root, and all the gooey, yummy starches, potatoes, red potatoes, things. Yeah, so as soon as we tighten the gut, everything starts to heal. And if we can't tighten the gut, then it means more peptides, more supplements, more interventions, blah, 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 blah. It's not really fun. So when we tighten the gut, I think they just feel a ton better. Yeah,
Yeah.
yeah. Do you like nutrients like vitamin A and
Yeah, look, I would use a lot
magnesium?
of A, glutamine, zinc, but to your point before, when there's big mast cell and SIRS come in, they are allergic to everything, including most of our supplements. So you're
Yes.
right in, I was talking to you off camera before about some of the cases that get sent to me, and those are those highly reactive patients. And so I can't use those. But in a general population, yes, I love vitamin A, zinc, carnosine, and then like glutamine, L-glutamine, and things like that. I probably would generally put in there, maybe some aloe vera, depending. But yeah,
Yeah, yeah, exactly. Yeah, it's hard when our hands are tied and all the normal stuff we would do, right, starts to backfire. Yeah. So
exactly.
because if they're missing a lot of flora, we try to do the vitrac.com test like early on, but I can always predict like what's going on. If they have any kind of autoimmune disease, if they have any kind of like food allergy or any kind of histamine issue, like they have a very, very permeable gut. So we bring our probiotic on your last podcast, I reviewed some studies about like how certain species and probiotics actually, reduce CKD like after 3 months.
Mm,
Yeah, like usually it's like 4 billion or, they have different probiotics. Like out of Brazil, I came across a CKD study. They were hemodialysis and stage 3 to 5, and they used 4 billion a day, and they brought this cystatin C down from 3 to, like, instead of increasing to 3 to 3.18, it went down by zero point 0.1. So that's
yeah.
pretty significant. And they saw statistical reductions in PTH compared to placebo. And in other studies, there's like many probiotics that have delayed CKD. So whatever the reason might be, like whatever the offending reason was, like they use B. infantis, B. bifidum, some lactobacillus plantarum, and some acidophilus. So I think it's like strong evidence. There's also a meta-analysis where they looked at like 552 people, 10 studies, and all kinds of improvements happen. Lowered blood glucose, less oxidative stress, inflammation, reduced progression of CKD, even improved lipids. So I think probiotics is what ultimately keeps our gut tight. We see that in centenarians because they have the whole core biome, and all the healthy
Your
cores. And
ABCs.
they can eat
Yep.
anything. Yeah, they're all eating gluten. Every centenarian actually eats gluten, but it's not USA gluten necessarily, but
The
it's
glyphosate the level might be a
oh,
little bit
yeah,
lower.
yeah. And the hybridized amounts that have so much more gliadin, alpha gliadin, and
Yeah,
all those toxic bad gliadins that are sticky. Yeah. So the
yeah.
dial really changes too when we support the adrenals. Like my favorite formula is using a Chinese formula. Um, it's a con formula called Celestial Emperor.
Okay.
And yeah, I forgot the Chinese name. I'm Chinese, but I can't remember all the pinyin in the names. And Metagenics has been selling that formula for a while. So we also sell it on our store. It's called Serenogen. And
Yeah,
they've sold
right.
it for 20 years. Yeah, it's like amazing, I think, or at least 15 years. So Serenogen is that Chinese formula. And when we add it on, people just feel amazing. It's not stimulating and it's not sedating at all. So when there's autoimmunity, people are stressed, or when there's even gut dysbiosis, there's a baseline background of stress. And maybe they were having leaky gut since they were a child, like or a teen or in their 20s. Like they just got used to it. And so to not have stress by relieving it biochemically and biologically using, an adaptogen formula, they learn a new level about themselves. And then with less cortisol, because cortisol causes leaky gut and permeability, we're tightening everything. So we
Yeah.
build the resilience, yeah. And then I add the regular nutrients like animal vitamin A,
Yes. Thank you for saying that.
B.
Yes.
I know, like I'm sorry, vegans, but you have to do a real retinol because that hits the RAR, some really important nuclear receptors for healing and regeneration, RXR and RAR. We have to
Mm.
have liver, cod liver based, or any kind of liver, human, animal, not human, sorry, based
Right. So
vitamin
what are
A.
you up
Yeah,
to?
and some vitamin A, especially if it's made from a benzene ring from petroleum, it's toxic.
Mm-hmm.
Yeah. So, and then a lot of it's just synthetic, retinol palmitate, retinol, all these like synthetic fake, salts. And yeah,
Yeah.
yeah, it kind of grosses me out. So, and then if they can tolerate, plenty of vitamin C, I always check the 125 OHD2 before I add vitamin D. But you're in a sunny place right now, and we're in the middle of winter, but vitamin D is so helpful, but not if they already have high levels of active vitamin D. No one really checks it. So the active vitamin D blood level is called 125 OH2D2. It's really important to check because our half of my clients, or at least, well, I have like kind of a healthier cohort now, but I used to have really sick people, and it was like literally every other person had a high calcitriol and they
Yeah.
weren't taking it. I mean, okay, some may have been taking it, but we had to quickly rip it off and stop it. And then after our protocols, it's high because either the immune system makes it or actually systemic infections. They're usually fungal or parasitic bacteria. So like Cryptococcus, Mycobacterium, mold, they're lending to these calcifying types of hormone levels of active vitamin D. So these people are basically calcifying like their soft tissues, with, whether they're taking vitamin D or not. So we heal a lot of those infections. We do some antimicrobial treatments
Mm-hmm.
to heal the gut microbiome and the imbalances there. It'll take care of like parasites. It'll take care of staph and strep. Commonly, there's a lot of E. coli, proteobacteria.
I see the same thing.
Yeah, do you
Yeah.
see that a lot? Yeah.
Mm-hmm.
And the higher the levels, like sometimes those will be 2, 5, 10%. That's like more than
Mm-hmm.
Biff. That
Mm-hmm.
is scary as AF, right? Why
Mm-hmm.
is your pathogens, right? It's like debt, bankruptcy, more than your good stuff, your assets.
Yeah,
Yeah.
for sure. I see
That
that.
that yeah, that is that's the autoimmunity right there. As soon as we switch it, so we do gentle killing. I like it's not like about antibiotics and we're not using anything strong. But I do have to say with a lot of the mold, we have to do like stronger mold protocols. So that if mold is present, we do the full mold protocols and some rotation and really low dose pulse, itraconazole, and or we alternate with other ones like fluconazole. Fluconazole is really great to start. Just really, 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 low weekly, only a few doses a month. What studies show is when there's a lot of prescription drug, azole drug class for antifungals, there's more drug resistance.
Ah,
And
interesting. I
then you
didn't know
can't use them later. Yeah, they just become you can't use them. They're all the fungi are resistant. So it's
that.
really you don't want to get down there because then you can't use anything. So that's a standard protocol. And then for peptides, like I'm so into RO290. It just knocks out autoimmunity. And if they happen to have chronic pain, like a lot of them have some degree of autoimmune, just inflammation related pain, chronic pain,
Yeah.
inflammation, joints issues.
Yeah, I never got ARA to do anything with pain for patients. Isn't that funny? Like that doesn't.
Yeah, only it's more like the peripheral and like one out of three. But there's so many
Yeah,
other benefits. I just love that.
true. That's true story.
Love
Yeah.
that one. Yeah. And KPV is my fave. So
I use so
all
much KPV. Most of my patients are like KPV.
yeah, love it, love it. And actually, a lot of SS31. You turned me on to it when I was
Yeah, I love
watching you
it.
and talking about it. So amazing, so amazing. Especially when kidneys are involved. Such
Mm.
like gut, brain, kidney. Such a high and heart probably high degree of mitochondrial workload there. They
Hmm.
are just
Hmm.
the nuclear powerhouses because we use them all day long, every day, for every second of our lives.
Yeah. Yeah,
Every
exactly.
second of our lives. Yeah. We're
Yeah.
constantly peeing, constantly eating, constantly digesting, probably thinking too much. I could probably get rid of this one. Our heart's beating every second.
Yeah. No, SS31, like I literally, that was on my plate of peptides this morning. And I feel very different when I'm running a course of SS31. And not these big doses, like 1 ml for me. I mean, the
Yeah.
purity on the one we've
Yes, I
got.
have to try that one. I can't wait. I've ordered it. Yeah.
I've noticed a massive difference to switching to that one, and it's because the
Mm.
purity is bonkers. But yeah, I feel different when I'm running SS31. I would say I am a hyper responder to SS31, but even just 1 ml, and I feel fabulous on it.
That's amazing. That's amazing. Yes. Like I love taking 200 micrograms just at night.
Yeah,
I call it,
right.
yeah, stack with like other peptides like B733 for like lowering fibrosis scarring, or Penelion or Epitalin, any of the brain ones. Like I just wake up like more myself and radiant.
Yeah,
Like, yeah, I just love SS31. It's really good for nutrient partitioning. You can eat more carbs. Like, you can just do so much on it.
yeah, yeah, yeah. No, I totally agree. So,
Yeah.
okay, so KPV probably in these kind of cases would be my go-to. Do you get
Yeah.
in your really sensitive patients with mast cells, and because I know KPV dosage rise, I was reading an article the other day, in high doses, it acts as a counterbalance, so it'll drive up mast cell. Are you,
I think why is because it's really potent as an antiviral, antifungal,
I wondered.
anti-staph and strep and anti everything in the gut. So we literally in the mast cell and sensitive folks, I only do a pinhead amount twice a week. You'd be shocked how effective it is.
Yeah,
And
right.
even then, like a week or two later, they have massive die-off. It's like very delayed.
Okay.
Yeah. Yeah, very, very, very delayed. So I have to keep checking in, like, because if it is, we just stop it and they feel amazing. It was that. It was having some cumulative good stuff, but also not so great stuff. Not so great stuff. Yeah.
Yeah, interesting. No, I've
Yeah. KPV is scary sometimes. Some people don't like it because they OD'd. Yeah, the dose just wasn't titrated properly, and then they didn't feel so great. Yeah.
yeah,
But it's a lovely, amazing peptide. Oral. I haven't done it nasal yet with clients, but oral and jab. It's
yeah.
part of the CLO, which I love.
Yeah,
Um,
there's so many cool things. Okay, so once you've got someone through that basic protocol, are you starting to see some really amazing changes then? Or is it something where you're like, okay, no, this is sort of months to years, we've got like these big back end protocols we still have to get in? What sort of,
oh no, no. Okay, I used to do the old school way. We do tons of tributyrin.
all right, yep.
Okay, like 10, 20 caps a day.
Oh, wow.
Yeah. We would do tons of SPM. I like Metagenics brand. They moved to one daily. Super potent. It's so amazing. Again, 10 to 20 a day. It's like the steroid, right?
Oh, wow. That's a
No
big dose.
steroid side effects.
Yeah.
Yeah. They're acutely inflamed. They are so inflamed. Their ears are falling off. Their skin is bad. Their kidneys are failing. Yeah, no, it is gonna knock everything out. And we'll actually do it for 2, 3, 4 months. But the autoimmune panel, And I haven't had too many CKD. They were more like kidney stone induced or related to autoimmune IBD. But I generally see autoimmune factors normalize in 2 to 4 months or less with this protocol. And probably because we're using massive doses. Okay, with the probiotic, okay, we're doing super gut reset doses, which is basically a curated fecal microbiota transplant, but with curated species that we know of. So there's 7 species here, and then we'll add on Terraflora or Equilibrium or other probiotics like
What
AOR.
dosage are you using? I probably am
They do a
underdosing.
tables. I know I didn't ship this to you because it has to stay cold, but
Right,
you're
yep.
in hot Australia right now. It's like 120 degrees, so it probably would have melted and gone bad, but the capsules are great. For that dose, you need 10 a day.
10 a day. Okay, I'm
People's
underdosing.
low, yeah, that's why I sent you so much if you ever want to try it out
I'm going
yourself.
to keep it all for myself. I'm going to go. I'll keep the rest for
I know.
myself to get more.
Yeah, yeah. So it's called the gut reset dose, and you have to work your way up. I personally take a tablespoon every most days of the week, but because I'm the formulator, like I'm okay with it. And most people are eventually, if you can't or you have any reaction, that means there's huge dysbiosis, just huge, huge, huge,
Okay, interesting.
huge,
So it's
huge, huge.
almost, you
That
can
is,
almost challenge the gut that way.
oh yeah, yeah. Like it's just like anything. If you can't take KPV, yeah, you got a lot going on. If you can't take
True.
BPC 157, you've got a lot going on. You've got a
Yeah.
lot going on. Histamines, Herxamer, mold, Lyme, heavy metals, everything environmental. It's in you. You just have to like really take it step by step by step. Yeah. So we're doing an FMT dose.
Yeah,
With an
right.
FMT, people are taking a handful of poop capsules or a quarter cup of poop and they're putting it through a nasal gastric tube, right? So this is about the same amount. Yeah, it's
Okay.
about you'll get a trillion, a hundred, you'll get yeah 1,000 billion, but a
Okay.
trillion.
I'm going to up my
So
dose. I've been taking 3 a day. Nowhere near.
yeah, and my goal is that people will see it like come out of their butt and their urine and like really express out because we're my goal is like our mucosal linings, they're not sterile. Placenta's not sterile either. We get translocation through our lymph of all our good stuff and our bad stuff. But if we have tremendously higher percentage of good stuff, right, it's going to end up in the right places where we want, like even eyeballs, even sinuses, even ear, nose, throat. Some of our clients, not only do they have like the autoimmune disease, they have some ear issue or some vision issue. With mold, there's a lot of vision issue because it's through the liver meridian and it wraps through the big toe up and then here. So that's why the visual acuity test, the
Yeah.
VCS contrast test is
Yes, yes,
so
yes.
sensitivity crest is so great
Mhm.
because even with die off, it will get worse there. But that's because your body and your liver is excreting all these mycotoxins and other toxins, and it's literally coming out of your eyeball. Yeah, so if we get
Yeah.
good flora there, then it's going to buffer that, and that this is probably what the centenarians and healthy cohorts who have all the core microbiome, the ABCs, they're full of all these good flora. Like I don't think I've even achieved that. I'm a little delayed. I have to do my testing, but I mean to have that cohort of core microbiome, that's like gonna keep us safe and happy and healed, for a whole lifetime and reverse CKD. Because once you're
Interesting.
pregnant, that's when the immune system, the Treg cells in the gut, they stop the autoimmune process. And Th1, Th2, Th17, they all get balanced. If it's Th2, like cytokine, IL-5, 4, IL-10 related, they'll all normalize. They're all normalized.
So Akkermansia, my thing is, can you? I know Pendulum make a product, but my understanding is they're not going to transport into the gut. What is your take on oral
They're all
Akkermansia?
dead. Yeah, there's no way. They used to ship it on dry ice. They're not doing it anymore. So it's like,
Yeah.
yeah, it's all dead. But they also come with like Clostridium butyricum and some U bacteria, which is a butyrate maker. I mean, I love their formulas. They're still
Yeah.
good. Some of those are probably alive. Clostridium is a spore-based probiotic. You can also get it elsewhere. But I love their formula. I wouldn't do integrative peptides. They have a gut something powder, and it's got like
Gut
100 billion
rot.
Akkermansia, 100 billion. We have 100 billion in ours, but these are all like kind of safer, bifidose and lacto. The Akkermansia at 100 billion, that'll kill you. Like it's just like high dose. Like I even cringe when I'm looking at it. But if most people actually have some akkermansia, it just may be so low in detection, and it takes the right fiber, the right prebiotic to bring it back. That's all. That's all.
So that's exactly, yeah. So I had a cerebral palsy girl that I was looking at her microbiome yesterday, and her bifidolongum and bifido species generally were low, lactobacillus was low, and Akkermansia was super low. So I just talked to me about, so I obviously know the berries are the big things that Akkermansia like, right? So I was just like,
Oh,
berries.
yes. Oh, all berries. Yeah.
Yeah.
Acai, blueberry,
So
blackberry,
particular,
all
yeah.
of them. Yes, they're great. Anything sour, they love it. Yeah, they love Chinese medicine. They love lonicifera, the honeysuckle.
Do
It's real
they? Did not
sweet.
know
Yeah, the
this.
flower extract. Yeah. And there's a another Chinese study I was looking at for CKD. This amazing group. Let me see what they did. They did astragalus
Yeah, so
polysaccharide.
that's in our formula because
Ah,
it's
yes.
amazing for kidneys, right? And it's one of our adaptogens and great for adrenal health.
Exactly.
So,
It's for everything. And it's a massive, probably prebiotic, because there was a study, it helped decrease progression of CKD. It was adenine-induced kidney injury. But they had increased lactobacilli, increased bifido, increased
hmm.
Faecalibacterium, the butyrate maker, increased, I'll send it to you, increased Akkermansia. Yeah.
Hey, I haven't even
The
looked at
prebiotic.
what the herbs do for
Yeah.
prebiotics. It's
They love
interesting.
bitters. So what is Chinese medicine is like all
We'll
bitter.
get off, yeah.
All bitter. And so they're getting the bile acids. Bile acids bind all the amazing FXR and other nuclear receptors that heal our gut and transform like certain fats and detergents and recycle, cholesterol-based steroids, but they are super powered and they turn on all these different amazing regenerative pathways. But without bifidos, we don't conjugate well, we don't glucuronidase or have other um, glucuronidation and detoxification. If we just
Yeah.
do our probiotic, that changes the beta glucuronidase on any gut testing in just one month.
Yeah,
It's just that
wow.
you have to have bifido. Yeah. Bifido is just the dominant species, but no one has it. Like unless they're doing the protocols with us and the right
Yeah.
fibers. Yeah.
No,
I was doing all the extracts, but I wasn't seeing a lot of bifido. It really took the high dose FOS inulin, which is in over 30,000 plants on Mother Earth. Like we're really meant to eat like huge amounts of foliage, like and also starchy roots. Like our macros should include that because like beans, they have ROS, raffinose oligosaccharide in the germ of the bean, and these are super powered for because we became we became protein dominant humans, like eating it from plants and also animals, and we need these fibers that come from there. So lentils and beans are like practically 12. Most servings are 12 grams for like half a cup. That's like half of what we really need. But I also take extra like 30-50 grams of fiber, and I mix like inulin, FOS, a huge amount of GOS, and a huge amount of XOS,
Mm-hmm.
and an optimal amount might be about 15-20 grams a day to really securely anchor all of them. Yeah, and any of the bitters, right.
Yeah. And it's
Yeah.
interesting. I was reading a study saying that, and I know you do a lot of work with GLPs, that part of the issue with GLPs is we just don't eat any bitter foods anymore, and you need bitter foods to have your body produce its own GLP. So someone was
Yes.
suggesting that the GLP deficiency that we're seeing and why GLPs work is that if we just increased bitters into our diet, we'd naturally have a kick up of our own GLP production, which I thought was really interesting. So a lot of my patients that if they're too sensitive or can't do GLPs, then yeah, I'll just get them eating bitter food that nobody likes doing. It's those really like bitter green leafies and things like that, and all Chinese herbs and things like that. No one
No
enjoys
one
doing
like
it.
you have
No,
to you really have to train your palate again. Yeah. Yeah.
yeah, it's really fascinating though. Like I love sour, like a bit strangely, but I
Mm.
always find it interesting that once you retrain the palate, like I can't do sweet anymore because haven't had sugar in my diet for like 10 plus years. And so even I was eating some blueberries this morning and probably any more than, like a small handful, I'm like, ah, it's too much sweet for me. So it's funny
Yeah.
how it does retrain itself.
Yeah, sometimes I get out of the salad mode, but my favorite salad is like a huge pile of arugula, which is very bitter. And
Very
it's
bitter.
actually a
Me
moderate
too.
oxalate, low oxalate food for those who are really watching all that. And because they're high in candida and mold that make oxalates. But I pile on like currants because it's a bitter in a way. It has high antioxidants and OPCs like pycnogenol and other OPCs and acai and blueberry extracts and then lots of blue cheese, currants, and a lot of Italian herbs
Mm.
with the olive oil or a little balsamic. Yeah, that will just
Yeah.
like get me going. And then maybe some walnuts in there. Yeah. Then I'll get retrained again and crave it again. Yeah. I know it's
Yeah.
hard. It's hard. But every nation that has centenarians, if you look at their diet, they eat a lot of bitter plants. Like in Italy, they eat purslane. It's a very bitter weed plant. It's all over the place, but very
Mhm.
bitter. And in China, you know, a lot of them eat so many different kind of bitter vegetables and like the mustard greens and bitter melon in Okinawa, at most everywhere, and they're a great source of vitamin C during the winter. Or I mean, months. You know, if they're all year round, I guess it doesn't matter. But we, you know, there's a synergy of all that food and the prebiotics that are there that feed our gut flora. Even you know, and we were talking like probably more autoimmune people have certain mutations like the FUT2, FUT2,
Yes,
because they
sure.
don't make enough fiber on their mucosal lining. That's why I focus on mucosal lining genetically, you know, they lost that probably because they had a high prebiotic diet and they didn't need it, and then they got this advantage, an evolutionary advantage of the FUT2 to evade pathogens like norovirus and other ones. It saved their life, but then they're at risk because they don't attract the bifidos to their mucosal lining with that
Mm.
expression. So we can fake it. I'm into faking it until we actually feel it. But we kind of have to keep it up if we're genetically predisposed that way. Yeah,
Yeah. And a
yeah,
huge percentage of my patients have the FOP2 gene. You know, it's one of those ones that I test on
yeah.
every.
Those are our clients. Yeah, some will say, "Oh, I don't have MTHFR," but oh my God, you have like 50 million MTRR like
Yeah, you've got
homozygous and
MTR,
heterozygous.
CVS, and Compton. Yeah, exactly. Yeah.
Yeah, yeah. But the gut ones usually they all have it. Yeah, sadly, and I think it's just our diet. You know, we lose bifidos. Maybe we didn't get it from mom. There's these extinction rates of bifido infantis, like Detroit and a few Cleveland. There's like no infantis, bifido infantis in babies, baby cohort studied there. So it would flip. Yeah, the infantis would switch after weaning to bifidobacterial longum and bifidum and other bifidos, but they if you don't have it, you're not going to switch and you're not going to have the right bifidos to unless you take a supplement. So studies show if they just supplement, then they've achieved it. They'll keep it up. That's why we have autoimmunity in kids now.
Well,
It's
isn't this true? You know, and cancers as well, you know, like things that you just never saw in kids before, we're just seeing all the time now. It kind of is bonkers of just how these were diseases of an older population have moved, and in very quickly, in a very short amount of
very
time.
short time. Yeah, during our careers, like it didn't happen at the beginning of my career, so
I
now
mean,
it's all happening. I know it's so heartbreaking. Absolutely
even
heartbreaking.
even kidney disease, excuse me.
Yes.
I've got
Even
patients,
kidney disease, yeah.
yeah, they're younger and younger. You know, I've got a big cohort of women that would be, you know, late 40s, in that perimenopausal stage, which I also think it plays a role. But, you know, like
Absolutely.
with kidney disease. And I just,
Yes.
when I started in this, it was, you know, our 70 plus people that were getting CKD, not our 40-year-olds. And yeah,
No.
40-year-old women. And it's crazy. And I've got a couple of really young guys, you know, and it's just, it's crazy. Yeah, like stuff I just never
Yeah.
used to.
Yeah. For the women, do you think birth control has also a role? When I grew up,
That's,
they didn't really give it to kids. And now, oh my God, even 8-year-olds, 10-year-olds are getting birth control, either for menstrual cycle or who knows what, right? Acne. But I think it's triggering because it's so estrogen dominant. It's also so it causes gut dysbiosis.
well, yeah, yeah. You know what? I actually hadn't thought about that. I wondered if it was a perimenopausal thing, but I do wonder whether perimenopause has gotten worse, to your point, because so many
Yeah.
women are on
But I
extended
think
birth.
also they stain our fat, unless
Yeah.
someone knows how to detox it. No one does that. And you need to have good bile acids to get it out once it comes out of the fat after you've had lipolysis and, liberation of them out of the adipose. Yeah, I worry, with this like GLP cohort we have, I worry when people lose massive amount of weight. This is being shown too. People who lose a massive amount of weight, they actually, when they track them, they actually have higher all-cause mortality, higher morbidity. And
Interesting.
they're leaner, they're skinnier than others, right? But they've lost so much weight, they've unloaded all that toxin and they just recirculated it again.
See, now that I definitely agree with, and that's why I'm big into if we are going to use GLPs, we need to microdose them and do them super carefully and with someone that
Exactly.
knows
But
what
they
they're doing.
still may lose weight, right? So they're still like, so I'm really like, I was kind of anti-detox when I first started my career, but now I'm like 100% detox because it's just bonkers, and I was lazy for a period of time. Like I tried this last year for a month. I didn't do binders. I felt worse. I felt
Yeah,
totally worse at the end of the month. And as soon as I took a binder, I was good as gold. And I was like, I screwed myself that whole month. I was just sweating and then recirculating, so, because it's safe when it's in the adipose. It's in a nice little fortress called fat. Doesn't go anywhere, doesn't do anything. It's usually not metabolically active. Because I'm one that doesn't lose fat easily. So mine was not metabolically active. Now
yeah,
it's probably a
right.
lot more metabolically active, but when it's in there, it's safe. It's not going anywhere. But when we start sauna and liver support and GLP-1s and heal the mast cells, the fat's going to be back online and it's going to
Mhm.
release and take on new things, but release. And if we're not capturing it, it's going places.
Yeah, fascinating. That's definitely something I definitely think with the GLPs and I've never been a fan of rapid weight loss. So, for all of those reasons. So, yeah, I
Yeah.
think it's something we have to be super cautious about. And I know the GLP ones are shown to be good as protective against kidney disease, but I think in
Yeah.
microdosing, because it'll have the opposite effect if we have these really, to your point, rapid weight loss because of the detox amount and the kidneys have to filter all of that. So,
Yeah, yeah. And I'm not sure how much heavy metals are in the fat. I haven't looked into that, but that would be released too if there happened to be any there.
yeah, yeah. I mean, heavy metals can sit anywhere, right? And then we obviously with the candida picture, heavy metals and candida seem to go. So you've got someone with a lot of
Wow.
candida. It's so
Yeah,
fascinating how the body works and tries to offset itself. And then, yeah,
yeah, yeah. And then do you see a lot of psoriasis? That's autoimmune as well. It always goes with the picture, sometimes with kidney, I bet, and others. So I try to track everything in the terrain. So we're healing ear, nose, throat. I love C-Lank nasal and with or without jab, because it starts the whole healing process. It's antimicrobial, believe it or not. It's so antiviral, so antifungal, but it heals our brain. And as it penetrates the blood-brain barrier through nasal route, there is mold. With autoimmunity, when the gut's permeable, there's mold and candida in the brain. So healing
for
the
sure.
brain and the biome in parallel is really key so it stays permanent. I used to have people fall off the bandwagon and then like, oh my God, all their symptoms would come back, including autoimmunity. I could not get their like Hashimoto's, or ANA down if that happened. But now, like healing brain and the biome together, doing some brain protocols like cortigen and solutin. Yeah, and sometimes if we have to, the P21 or some no OPEP, but just healing the two together is so beneficial, so very beneficial. We have people do sinus rinses with if they have
Yeah,
autoimmune of any source, yeah, and that starts the healing process too,
yeah,
because yeah, even their gut starts to feel better, and we're not going to re-inoculate every time they have postnasal drip or when they're lying down or sleeping. Yeah, so
yeah.
getting clear, and then their partners, so all any kissing or hugging, they're not going to get re-inoculated from their partner.
Yeah, yeah, no, the macrons and the nasal sort of stuff and the flushing is
Yeah.
just is in my, especially my kids with pandas, autistic sort of stuff.
Yes.
Yeah, that
Yeah,
macrons are just crazy, and then mold and all the stuff that goes
it
behind it. So,
is. Yeah, and we have them dab the probiotic, especially Microbiome Mojo, because it's got the bacilli. It's a soil-based probiotic, but you can also use any other soil-based probiotic like Terraflora or Megaspore and dab like the probiotic there, because then it'll seed the whole sinuses,
yeah,
and
right.
yeah, you get the resurrection and the C-Lank because even in the animal studies, when they jabbed the animals, they had a resurrection of bifido and good lactobacilli in the animals in their gut. Isn't it crazy?
Fascinating.
They
It
jabbed. So
is. That's not something I knew until you told me about cell last time.
yeah, GLP-1s too, liraglutide, and there's a semaglutide study. They had increased akkermansia and bifido.
I did see with the GLPs. I had never seen it with the cell. So yeah, it's so fascinating, isn't it? And how when you change something, how then the microbiome will like mimic it, and so you suddenly go, well, there's this whole crosstalk going on throughout the whole body, right? And so getting one right, how if you can influence it, the microbiome is, I wouldn't say it's easy to influence, but diet and getting the right probiotics in the right time is easier to do than, you know, going
Yeah,
in and mucking around with your microbiome in your brain
one
and things like that. Yeah.
exactly one meal, one fiber shake, one berry extract, or one bitter salad. Like I think it really can. I feel it. But I'm
Yeah.
more sensitive now, thanks to like certain peptides and Clotho-1 and others. I can feel things more.
Yeah, yeah, all the good stuff. Grace, this
Yeah.
is amazing. Is there anything else that you want to cover off or say, for when it comes to autoimmune disease? I feel like most people understand with autoimmunity, the gut is so important. I think you've given us some really good protocols and some good products and delving into the bifido and then everything else. But is there anything else that you feel like anyone with an autoimmune disease should know or should be checking for on top of mold and things like that, just to really dig into that to help shift that process or, transform that process?
I mean, looking at root issues is always important. So other root issues might be belief systems. We've talked about this, like maybe hypnosis would be helpful if there's some negative self-talk and it just won't go away, or something spiraling. And that can be immensely, helpful. I'm into, like, in Burkina Faso, there's some rituals, spiritual rituals there, where they do divinations, and people heal their ancestry and heal ancestral wounds and get better connection and relationships with that energy pattern and people in their lives. I believe that's super helpful, like amazing.
Totally. I think, yeah, and I think when you've been stuck in a chronic disease for a long time, I think it's a miss to not look at that stuff because you mentioned stress before. Without even having to go into those lines, if we were stuck in a chronic stress pattern, being able to have a look at all of that and re-regulate our nervous systems down to, they've done plenty of studies now to show that our ancestral trauma does get passed through our DNA, which is very annoying. Thanks, grandparents. And
Oh,
so
I
having to
know.
heal
I
that and do
know.
that, you know.
Yeah, those methylation of the CPG islands and other things, like they all came to us. But I do think, we can just think of things and believe and have faith instead of fear. Like they can switch off. And I
Yeah,
wish we had
totally.
more recipes for that. And then peak our oxytocin. So some of my autoimmune clients, I can tell they're very oxytocin depleted. I really can. Like their faces are really flat despite all that we're doing, and their serotonin should really pop up. I mean, it will just take 4 or 6 months. It eventually does. And they're like doing all kinds of things. Apollo, Pulsetto, vagal stims, and they're still struggling there. And that's when the clinical hypnosis and divination and other rituals. I think in our tribal days we only had like a small group of people, like 20 max maybe,
Yeah.
and I live alone. Like I barely connect with anyone in a week, like unless I'm going out driving and la 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 all this stuff. Like where's my 20 people, right? And I don't get a lot of oxytocin. I'm seeing you right now. I'm getting a surge of oxytocin. Thank you very much. you know so I do like injecting it.
Yes, yeah. No,
I
I
do
think
love it.
I think that's such a good point. You're right. And especially after COVID, I'm like like I see patients online. I get to the gym every day, but apart from going to the gym and then patients online, you're right. You can go through a week where you don't connect like you used to. So I have a Doberman though, and he definitely
I
helps.
know your Doberman makes up for so much. He's so adorable.
He's so cute. He's on a walk right now. But do you ever use oxytocin nasally, or do you rather inject it?
The nasal didn't work for me that much. I don't know why. I haven't gone back to it, but I should check it. I should like amp up my C-Lank and put it in there and do it. We'll just do a line. No, I'm kidding. I love injecting it. Like I kind of built up my dose to like 100 micrograms, and then I got up to like 125, 150. I'm a little terrified of like starting up at that dose again. I might have to start at 100 and like titrate up again because there's times where maybe I didn't like uh yeah, like I was trying a higher dose and like oh my God, I had the full flushing, diarrhea, everything, and I thought, holy fuck, this is why people don't
Yeah,
like
don't
keto
like doing
diets.
it. Yeah.
Yeah. But when I'm at the perfect dose, it's great. I just add it to my Wolverine and I do it every day. It's
Nice.
so beautiful. It's really nice. Yeah. In couples therapies, they've used it intravaginally, like it's so
Hmm.
beautiful and builds bonding and healing to, and men can take it either way, nasal or jab. But it's finding the dose. I think that the more depleted someone is, like I gave like one of my clients, he's probably super depleted and because he was in the hospital for a period of time in the ICU a while ago, but a lot of IV antibiotics um, and got, kind of disrepaired. So we did a microdose, like 50, and oh my God, it floored him. Just
Yeah,
floored
wow.
him. He almost passed out. I was like, oh no, don't pass out. And then he was fine. But yeah, like we'd have to start super micro dose and then build up. But I think it has great pathways for us for healing.
Mhm.
Studies show probiotics, like especially the bifido strains, they increase in animals. There's a surge of oxytocin, which is
Right.
also, yeah, the wound healing that they see is attributed and statistically related to some of that. And we know mother's love is, always so helpful. They've done, I think, with like testing with kids, a hug is equivalent to a lollipop, like not that lollipops that helpful, but like
Yeah, I know what you
that
mean.
there's like but there's healing and there's probably like there's something I think ancestral about it. Like when we see people, there's a natural surge, when we see even people hugging or handshaking, we whoever's viewing it gets a surge of oxytocin. Not only the people engaged in that friendly, kind, mutual affection. And it's so
Yeah.
hardwired for both men and women, I think. Babies, even male babies, they would feel their mom's oxytocin. It's in the milk, I'm sure.
Mm.
Yeah, and moms like we can't get a letdown unless we're like we see the baby, feel the baby, or hear the baby or something, and then there's prolactin and oxy. But that's like a main pathway to nourish the next generation. It's really important. And that's their immune system. The milk is their immune system, right? And they would die otherwise. So it's literally the longevity of these helpless, motionless babies, who can't move or anything. So I think it's key to so many things. And if it didn't get built, I think there's some autism studies and abandonment studies. My parents are Asian. I doubt they hardly cuddled me. They didn't cuddle. Like, so I think I was very oxytocin deprived. So
Yeah,
I'm kind of
interesting.
making up for decades of that.
Yeah. Jabs and sprays. I love
Yeah, I
it.
know, I know, I know. Yeah,
Grace, have you,
there are cuddle puddles here in the Bay Area, so
oh yeah, cuddle puddle
there's still
parties.
other ways. Yeah,
I forgot about those.
we're all woo here.
Grace, are you seeing patients? If people wanted to work with you, is that something they could do? Or are they best off reaching out and starting with working with products? I know before we hit record, you're flat out in clinic at the moment. So walk us through how someone could connect with you.
Oh, yes, they can connect with our clinic and just reach out to us, or they can just book a consult. That's awesome. Yeah, and they just reach out to at us for us at thegutinstitute.com. Yeah, a lot of ways
Perfect.
to start seeing us. We have very affordable like group classes. It's a kind of low touch, but they see me or my team every month for group coaching. That's a really great way to start too. There's 8 pre-recorded modules to go through all the gut healing, and then the live group coaching. I talk a lot about peptides now and people just love it, love it, love it. Yeah. Yeah.
Amazing. Grace, as always, you're a wealth of information and such a joy to have on. We'll have you back. We might go down the probiotic, gut health, kidney stone, oxalate pathway with you next if you're up for that
Ooh. We're gonna
rabbit
piss
hole.
off a lot of LOD people.
Yeah, we are. We are. So we might do that one next. I love it.
I
I
love
will.
that. I love that.
Excellent. I'll put all your details below. If you want to find out more about Grace, head to thegutinstitute.com. Make sure you hit subscribe and like. That way you'll get notified anytime we put up more info. And if you want to know more about us, head to kidneycoach.com. You'll find us on Instagram and Facebook under the same links. Grace, as always, it's a joy, a pleasure, and so wonderful to see you. Thank you for being on the podcast, and we'll have you back to discuss all things oxalate and annoy people with all the great stuff you have to say next
We're
time.
rabble rousers. You're a pillar of information. Thank you so much. You're the peptide princess. I admire and just respect you so much, and you're so inspiring. Thank you, thank you, thank you.
Oh, ditto. And thanks for everyone for listening. We'll see you next time. Bye.